Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
Good afternoon. Welcome to the City Council Informational Meeting of September 22nd, 2020. I call this meeting to order. I believe we have Councilor Brecky on the phone. Can I just confirm that? Councilor Brecky, you there?
Yes, I am here, and I would like to add, under two committee reports, I will be given a report on the ESF committee meeting that was held at 11:30 today.
Okay, very good. We'll get to that right after the UDC. First up is item 2A, committee and commission reports. The first is the Urbanized Development Commission. I'm going to make that report. We discussed the Sioux Falls 2045 plan, the long-range transportation plan, the first draft. That is an update to the MPO's long-range transportation plan. We have to have one of those to qualify for federal dollars for road projects. And we just went through the first draft of that. There's going to be public input on that in the coming weeks and months. We approved revisions to the TIP Transportation Improvement Plan to add more dollars to a few projects because of scope changes, and there's also a project that the SDDOT is going to coordinate to add lanes and add capacity, reconfigure some things, and do some signal changes at I-90 and Marion Road, and that is mostly because of growth that we have right now, and also growth into the future with things going on at Foundation Park. We approved a letter of support for grant applications for the city of Brandon to the federal government for constructing new roadway on the east side because of growth over there, and also a grant application letter that we approved for Hartford for a multimodal pathway that children and pedestrians primarily can use in the core part of the city, which is very near their downtown. Sam Trebilcock presented the Coordinated Public Transit Human Services Plan, Annual Progress Report, and the major parts of that was talking about the core transit team and some of the work that they've been doing, the pilot we're going to do, and then also what we've been doing to continue moving agency trips on paratransit over to CCTS, which creates cost savings for the city. And that pretty well covers the report. So next we will move on to item B. Councilor Brecky, do you want to take that for us?
Yes, thank you. There was a meeting of Experience Sioux Falls today at 11:30, and as you know, that industry is one that is struggling the most through COVID. And so I'll just give some of the things that they've been dealing with, and then it does kind of end with a bright spot of good news. July 20th through September 14th, they had 50 cancellations, of events. There were down 70,000 visitors at Falls Park. That's always a good indicator of how things are going to Sioux Falls, and we use that for demographics to learn where people are coming to visit us from, and that was down. 84 groups canceled their bus tours. In response to this, Terry and her team froze expenditures, and they made decisions, a lot of economic decisions, which I won't go into because you're aware of this, having just went through their budget hearing last week. You're kind of up to speed on this, but they made some decisions. For example, they decided they would reuse this year's visitor guide because it's difficult to go and ask for donations for that or for advertising in it right now, and they've got plenty of leftover copies because it was not obviously a hot ticket item. So they're just going to use that and explain that to the industry and save some money there. They're trying very hard to end the year with a break even, but that's going to be very difficult for them to do. They're down about 120,000 at this moment. They're still working hard and looking ahead, and they're really jumping way out. And actually, if they look 21, 22, 23, 23 is looking pretty good. So they're trying to, keep their chins up and think far ahead. But, everything is starting to pick up a little bit. And they've seen, really some good pickup in August. In August, interestingly, in our regional comparisons, they were up as number one for the regional year-to-date in occupancy. But it was at 45.6%, which is horrible. So you're number one, which is better than nothing kind of thing. But, it's good to see things begin to pick up. They would say that the governor's advertising is definitely that is actually helping our situation, and that there is definitely some benefit from the current climate that's being generated by her letting the country know that we're open for business. They're doing a lot of things creatively and innovatively, as are a lot of people in this industry. They're doing virtual press trips to stimulate activities in business and meetings, sports, attractions, and leisure. They're starting to get back on track with their marketing campaign and get that back up and running. They're working on a new website that's going to be consistent with Experience Sioux Falls. They're still moving forward with that and hope that to be open in October. To put it shortly, I mean, they're really trying to stay ahead of the game as much as they can. The good news is that Pheasant Fest, as best they know, Pheasant Fest is still coming to Sioux Falls in February. And that $225,000 that the city just authorized for them to have will be put to good use. There'll be more to come on that. But there's exciting opportunities that are going to be created revolving around that. So they're very grateful to the council for doing that and to the mayor's office. And that's all I have. Thank you.
Thank you. Thanks for the excellent report. Next up is City Council open discussion. Any open discussion from the City Council? Not seeing any. The only thing I will bring up is we were just notified today that Highway 100, the south side, is going to be completed, which is an enormous win for the city of Sioux Falls, and major kudos need to go out primarily, I know, to Mark Cotter and Shannon Austin, who have worked for years tirelessly on this. And I think Shannon Austin has maybe said that, I think she started with the city in maybe 1992, and they were talking about it at the time, and one of her goals was to get this done before she retired, and it looks like she's going to get it done. So the state is contributing, I believe, $170 million, and construction will be, I think, 2023 to 2026 at this point, and the city will be doing another $38 million, something like that, for the city share for arterials. So it's going to be a $200 million investment, and it's going to be transformative in the city of Sioux Falls, and something that we wondered if it would happen in 50 years, and it's going to happen. So, Councilor Kiley.
Yeah, just to be clear, you're referring to the portion of Highway 100 just south of 57th Street going around to I-29.
Correct. Veterans Parkway from 57th Street, wrapping to the west over towards T, and I-29.
Wasn't too long ago, individuals were telling me that that would never be done, and I was telling them otherwise, so it's good to hear.
Yep.
Yeah, there's one of them.
And obviously, major thanks to the state and to the governor's office as well. So, we're going to move on to presentations. Item A is COVID-19 update by Jill Franken, Public Health Director, and we also have with us today Dr. Michael Elliott, Chief Medical Officer at Avera McKinnon, and Dr. Mike Wilde, Vice President and Medical Officer at Sanford Health, and we are delighted to have him here today. Welcome.
Good afternoon, City Council. Happy to be here this afternoon to provide you a quick overview. I'm going to have just a few things that I'll talk through and update you on, and then I'll turn it over to the rest of our unified command. So just to kind of go through daily, weekly, monthly, quickly. New cases today in Minnehaha and Lincoln County were a total of 73. There were a smattering in McCook and Turner County, and the state as a whole was 320 cases. And then new cases for the week ending September 20th was 435 for that week for Minnehaha and Lincoln County. There were a little over 40 cases in Turner and McCook. The state of South Dakota had 1,875 cases. For our MSA, which includes all four counties, Minnehaha, Lincoln, Turner, and McCook, we had 25% of the cases in the state. Just to kind of give you a perspective, we're starting to kind of look at that a little bit to say, based on a population, how much are we experiencing as compared to the rest of the state? Because you might remember early on, we were the lion's share of all the cases in the state, and we're slowly, but now very consistently seeing that we're getting closer to what is our percentage of the state's total population. So then when you look at our new cases for the month of September, so from the 1st to today, we're at about 1,184 cases for Minnehaha and Lincoln County. The state as a whole is around 5,360 cases. And again, that period to date, we're about 23% of the total cases in the state when you look at what we've done thus far the month of September. The weekly positivity rate for Minnehaha and Lincoln counties is 15.4% as of the 19th of this month, and that's up a little bit. It was 13.3 the week prior. So we continue to track this data. You can go on siouxfalls.org/COVID-19, and every day by about noon, 12:30, we've updated it with today's data, and you can go back and look at other data. And there's ways to click on the buttons to be able to find MSA data in addition and then scroll down and you can see other data as well. So I invite you to peruse through our dashboard if you haven't had a chance to really do so in great detail. So one of the things that we're tracking is hospitalizations. That's a very important indicator and metric for you all, and that's what I'll let the doctors talk about in a moment. But a couple other things that I want to update you on is we continue to do a lot of testing in our department. Falls Community Health is doing that testing for a number of our partners in the community as well as for us as a city, for our critical infrastructure employees, as well as our patients of Falls Community Health. And we're seeing an increase in that demand for that testing, so much so that we started a drive-up clinic every day for, I think it's an hour, 2 hours, sorry, 2 hours, and we have folks just drive up, we get their sample, and then they can drive on away. And that's been working out really well for us, and it limits the traffic coming into our building as well. That partnership is with, again, for our city employees, but also for county critical infrastructure employees, so it's a nice partnership with the county to help them out, school district, key staff, critical infrastructure staff, as well as Southeast Technical Institute for their staff and employees, and that's a key one because they actually gave us one of their Abbott machines so that we can use it. They got one from the state, and so they let us have it, and then we do the testing for them because they had no mechanism to really be able to do the testing. So that's expanded our capacity to do testing and also helps them out as well. So we're happy about that. Also, we're continuing to work closely to monitor what's going on with the school districts. Certainly, you know, we are a strong partner with several of the school districts in our city limits, and most notably, we stay really in close contact, and they contact us regularly, is the Sioux Falls School District and Bishop O'Gorman School District. And so we're continuing to monitor how they're doing and what's happening. And then we're also really closely following some of the decisions that are being made with the other school districts that you've probably heard about, reported in the news and the media. So some things I want you to be aware of because it's going to be coming up on the consent agenda in the near future. You remember us talking about Councilor Jensen. It might be something you weren't as familiar with because I think this was mostly happening before your time on the council, but we had a recovery center in place, and we had that up and operating until sometime in June, I think early June is when we stopped that recovery center. But that was for our folks in our community that can't successfully quarantine or isolate in a dwelling. So they maybe don't have a home. They may be coming from Union Gospel Mission or Bishop Dudley, or in a multifamily house that doesn't allow them to quarantine or isolate. So those referrals come from the county, and then we placed them in, it was a hotel that we worked with and contracted for those services, and it worked out really well for us to be able to have a number of individuals be able to successfully quarantine and isolate, and really I feel like it was very successful in helping keep some of our rates of transmission down. Well, it's not been necessary for us to have that over the summer. We've had very little demand for that, and so just ones and twos needing to be able to isolate or quarantine in that manner, and been very much able to manage that without opening up a recovery center. But with fall coming, we know that's going to change. And so we've been looking and strategizing on a partner, and Lutheran Social Services, we reached out to them, and they have grabbed onto the opportunity to work with us because they very much understand that population that is served through those recovery sites and centers, and so we're working together with them in the county to be able to stand up another recovery center. So you'll see some contracts coming through to that effect in the near future. And we're going to scale those. We're going to start on a little smaller scale and then scale them up as we need to when the demand increases. So COVID vaccinations. The state, we are planning for COVID vaccinations. We're in the throes of influenza vaccinations, and a lot of work being done to find creative ways for us to be able to vaccinate our city employees, or others in the community that we partner with. And but one of the things that of course we're having to plan for is the COVID vaccinations that we'll be needing to do in our community. And so the State Department of Health actually is creating a vaccination implementation committee. That's going to be a statewide committee. That just always makes me feel glad when that's not my phone. sorry, Councilor Sale. And this implementation committee is going to be comprised of representatives from several different areas, from a number of different organizations as well as occupations. And Sandy Friends from our team has been asked to join that committee. I can't think of a better person because of her broad scope and understanding and work throughout our region, actually, this region of our state. She's been very instrumental in that work for a number of years, and so she'll be a great addition and asset to that committee, and it'll be really good for us to have her on that committee. So the planning considerations for that committee will be vaccine allocations. So, how are they going to be allocated out to various communities for distribution and for vaccination? What are the priority populations? This is something that'll be designated at the federal level, but certainly then we have to manage that in our state. What's the current level of illness in the community? Because that's going to really impact how we can deliver vaccinations. If there's a lot of illness present in the community, that's just going to be a complicating factor that we'll have to work with. Cold storage of the vaccinations, you've probably been hearing that that's going to be a real key factor, because for sure one of these has to be on dry ice, minus 80 degrees for one of the vaccines that we'll be getting, as well as one that has to be very cold and kept very cold as well, but not quite to that temperature. And so those are things that we're going to have to work with, as well as the fact that you need a second dose for this vaccine to be effective. And so that's something that is a whole different process, to have to do 2 vaccinations to be able to track and trend and understand all the needs, or, how do we get people back for that second vaccination, and the right vaccination, because there'll be a couple different options that'll come to us. So I think that really covers most of what I would like to, update you on. I'm going to now turn it over to Dr. Wilde, Mike Wilde from Sanford, and he'll give you an update as well.
Welcome, Doctor.
Thanks. Good afternoon. Mike Wilde, Vice President Medical Officer at Sanford Health. So at Sanford, we've seen a recent increase in the number of patients we're treating for COVID. By my review this morning, 15 to 20% of those patients are from Sioux Falls. Otherwise, we've seen influx of patients really from anywhere, out of state and in state as well. We've also seen quite a bit of care needed for patients presenting with various other illnesses. And we have seen that not only within Sioux Falls, but the areas where we have presence as well. And just really seems to be a bit of an uptick in illnesses at this time, but also patients with surgical needs as well. And so have seen quite an increase of numbers of late. However, we've been working for some time, and as I've talked to this group before, and I've talked to the city as well in regard to our surge planning, we've always been working on surge planning, and we certainly have been implementing some of that plan continuing to focus on providing the proper care for patients as close to home as possible, which is always our goal, and we have tremendous staff that's dedicated to that. With that, we've identified areas within our facility through capital investment that we can provide more space within the facility here in Sioux Falls, as well as outlying facilities also, and identified staffing opportunities to provide the care for these patients as well. We closely monitor our personal protective equipment and are doing just fine from that standpoint, but also continuously review our testing capacity as well. We have the drive-through testing facility, and with the colder weather unfortunately coming in, we are looking to upgrade that so it's more of a permanent structure and more comfortable for not only the patients seeking care there, but the staff as well, providing that care in a safe environment. We certainly encourage patients to continue to call first if they're feeling unwell, and give us a chance to properly triage patients as necessary. And as always, certainly, I think one of the biggest things you can do in the setting of a pandemic, if you're not well, please stay at home. And if you're trying to decide if you should go somewhere or not, you're not feeling up to it, just take a pause on that and stay home. With the influenza season coming upon us as well, we're seeing lower numbers in the southern hemisphere, making us optimistic, although no guarantees that we could see a lower or less of a season this year. But obviously we all have an obligation, I think, to receive flu vaccinations to hopefully reduce the risk for ourselves personally for a rather miserable illness anyway. So we want to encourage patients or people, if they're able to receive the flu vaccination, it's widely available in the community, and to seek that at this time. Finally, I'd just like to encourage people to take care of themselves. We have, there's an opportunity to stay up to date on your vaccines. We have plenty of capacity within our primary care clinics. Work with your primary care team to get in for those screening evaluations, preventative care, so that you're not winding up ill in the hospital due to things that could have been taken care of in a preventative manner at your convenience. And then also staying up to date on the other vaccinations as well, especially the children out there, getting them in for the proper care. The last thing to hit on too is, with what's going on, we see an opportunity from a mental health standpoint, and at Sanford we certainly have capacity and access for patients or for people who just aren't feeling well, stressed out with what's going on. There's been a tremendous strain on all of us with this pandemic, and certainly encourage patients. It's okay to reach out and just say, hey, I'm not feeling that great, and to seek that help. We have access, we have capacity, and we want to help with that. So with that, I'll turn it over to Dr. Elliott, my colleague at Avera.
Thank you. Welcome, Dr. Elliott.
Thank you. Good afternoon, council members. It's a pleasure to be here again in front of you. I know you've heard me talk before, so apologize for that. The benefit of following Jill and Mike, Dr. Wilde, is that I can say ditto, and that pretty much sums it up. We're all in the same boat. You know, when this first started, it seems like, years ago, but back in March, the fact that folks from Sanford and Avera and the City Health Department all came together, the centralized command center, we were able to share ideas, share concepts, have everything kind of on the radar screen, I think frankly speaks, very well to who we are here in Sioux Falls, how we believe in taking care of the people in this area. And that combination of efforts, that teamwork has continued to this point. We continue to stay in touch and continue to watch very closely what each one is doing and how we can best help our folks. Our numbers at Avera have gone up, similar to those of anybody else's in the state. A month ago, I could have said we have roughly 10 COVID patients at McKinnon, 20 within the entire system. As of this morning, we were at about 30 at McKinnon Hospital and about 75 across the entire system. An increase was to be expected. We saw the positive numbers going up. We knew the hospitalizations were going to follow, so this is not unexpected based on what we had been seeing in the news and the positive tests we were seeing. We also have at our disposal a number of different levers that we can pull for surge capacity. One in particular we have already pulled and have been doing so since back in March is to optimize utilization of beds and staff and equipment and testing and PPE, not just at Avera McKinnon, but across our entire system. So we've got 75 patients roughly as of this morning that are COVID positive across our system. They do not all need to come to Avera McKinnon to receive care. They are receiving very good, high quality care in a hospital very capable of taking care of them, actually closer to home in many cases than if we shipped everyone to Avera McKinnon. So part of our strategy that's worked very well and continues to work well is let's utilize bed capacity across our entire system. Let's make sure we're using our good staff across the entire system. Another thing we've done that's been very successful is leveraging our Avera at home services, our telehealth services. Right now, if you were to call the Avera COVID hotline and were having symptoms or met the criteria to get tested, we could help send you to a testing center, whether that's a drive-through center at our family health clinic near Marion Road, or one of our primary care clinics where we can do sample collection right there, a number of different options. And then if you turn positive at an Avera facility, an Avera lab, then you're automatically plugged into our helpline, and you'll receive a number of different phone calls just checking in, making sure you're doing okay, helping you with symptom management if you need that. If you have comorbid conditions that puts you at a higher risk, then you're automatically plugged into our Avera at home network, and you can receive phone calls from dedicated nurses. We can look to make sure you've got proper equipment at home. We can look to make sure that you've got follow-up appointments with your primary care physicians if you need. All of that over a 2-month period, I believe from April to June, we took care of about 350 people at home, appropriately so, well taken care of. The rate of hospitalization for those 350 people was less than 5%. So we do feel like we're able to provide reasonably good care to people, even though we're doing it virtually and we're doing it in the comfort of their own home. Otherwise, if all of those folks decided, well, I need a little extra care than I can get at home, so I need to go into the hospital, well, there's 350 additional people in our hospitals around our system, and you can imagine what that does. So we're happy with the success we've had there. Like Sanford, we're keeping a close watch on our sample collection kits, supplies, our testing capabilities. Right now, I would say on average, we can run about 600 COVID tests a day in-house. At times, the demand for testing is higher than that, and so we do have to prioritize some folks to have their samples sent to one of our outside reference labs for them to do. The turnaround time is a little bit higher with that, but the quality of testing is equal, and people are getting their results back in a good, timely fashion. We don't have any shortages in beds, ventilators, dialysis machines, they're all fine. We do think one of our maybe greatest risks is going to be a staff shortage. If folks start getting ill, if folks start getting exposed, if our youngsters have to homeschool or be home for a couple of weeks, and we've got a lot of parents that work for us and they're going to need to be home or arrange for some other opportunity for their children to be watched. So staffing is something we're keeping a very close eye on. Like Dr. Wiltie said very well, and I'll just emphasize it again, I think there's a couple of things that we can help stress in the community. If you've got general medical needs, by all means, please take care of those. If you need to go in and see your primary care physician for routine care, for screening tests, whatever, please have that happen. If you've got chronic medical conditions, please make sure that those are optimally under control as best you can. Influenza vaccine. You know, I'm a former pediatrician, so don't judge me, but I kind of think vaccines are really, really important. Given 2 doses of a vaccine is nothing for us. We do that all the time. So when we get the COVID vaccine and have to give 2 doses to patients, not a problem. We do that all the time, so we can figure that out. And then finally, mitigation strategies. Folks, with the numbers where they're at, with the percent positivity rate here in Minnehaha County and across the state, mitigation strategies are just as important today as they were back in March and April. Just as important. Please minimize your risk. Please use reasonable mitigation strategies whenever you can, not just to protect yourself, but to protect everyone else. Like influenza, COVID can be contagious before you show symptoms. So you can wake up tomorrow morning, feel perfectly fine, go to work, unwittingly, unknowingly expose friends, colleagues, coworkers, and then you start to develop symptoms. And then you call in, and then you get tested, and then you go, oh, darn it, I've got COVID. And now you've got to do contact tracing back, and you think about all the people you've been in contact with over the last couple of days. That's why COVID and influenza spreads as quickly as it can, and why it is so difficult to mitigate. Again, that's why it's so important to wash your hands, wear your mask, social distance, don't touch your face. I know you're getting tired of hearing me say it. I know we're all getting tired of doing it, but please, please stay vigilant in this. It is going to be a while before we've got enough COVID vaccine to completely vaccinate the population the way we need to. And even at that, you know, let's say you get half the population vaccinated, right? So 160 million people, right? If you get half the population vaccinated. And let's say the vaccine is 50% effective, which isn't bad for a vaccine effectiveness. We're nowhere near herd immunity at that point. So we're in this for the long haul. This isn't a sprint, it's a marathon, so continue to stay vigilant. With that, Dr. Wilde or I or Jill would be happy to take any questions.
Okay, great. Questions? Councilor Selberg.
Thank you, Mr. Chair. So I hear you encouraging people again to get in for their checkups, their, would you put general medical needs? I think you were saying that last time or a month or two ago, last time we saw you too. Are folks still staying away a little bit? I mean, I remember, I think when this first all started in March or April, I had my regular physical coming up, and I know for a while I was like, I don't know, maybe that's, do I want to go in? And I remember going in, and I think I was about the only person in the whole place, and I thought, I think I tried to encourage folks too, that might be one of the safer places to go as far as population anyway. Is that still, are people staying away when they shouldn't be?
It's getting better. Folks are all across the spectrum, as you might imagine. Some people are still very afraid to leave their house. Some are out and about and don't seem to be doing any mitigation strategies at all, and everyone else is kind of in between. But no, we have seen a nice return in clinic volume, people coming in for routine care, parents bring their children in for vaccinations, routine screenings, that sort of thing. So it's not perfect, we could be better, but yes, folks are realizing that in a healthcare setting, everybody's masked, everybody's washing their hands, no evidence that we're having healthcare worker to patient transmission. So like you said, very safe place to come in and receive routine healthcare.
Yeah, that's good to hear. And then you're not seeing like a spike in folks that are coming in and going, boy, if they'd have just got here a couple months ago and they were supposed to do their preventative, again, kind of things. There's just not a lot of that going where people are not coming in when they're supposed to. Now they're coming in, and because they weren't here 2, 3, 4 months ago, I mean, you know what I'm saying, is there a lot of that going where, I don't know how to word that, not like it's hopefully not life or death, but people are having health problems because they didn't come in for regular things a couple months ago.
No, I'm afraid we are seeing that, actually.
Yeah.
That is contributing somewhat to the busyness of all the health systems right now. And when people are coming in, maybe they're coming in a little bit later than they otherwise would have because of that hesitation. So we are seeing some of that, yes.
What can we do to encourage folks to get in?
You know, you said it very well. Hospitals, clinics, pharmacies. They're very safe places to go to. Good mitigation strategies are in place. And along with those mitigation strategies for each of us individually, if we can be as healthy as possible going into the fall, facing COVID, facing influenza, facing other cold and flu viruses, the better off our chronic medical conditions can be, the better health we're in, the better our chance of getting through this with minimal interruption.
Okay, well, thank you. Thanks for being here today, both of you.
And
Our pleasure.
I want to give Dr. Wilde if he had any statement he wanted to make regarding this. Otherwise, I can move on. Okay, very good. Councilor Erickson.
Thank you. Question for either one of you. As we move into influenza season, talk a little bit about the different symptoms between influenza and COVID, because right now, oftentimes, and I'm not throwing anybody under the bus as far as in the school district, but if you say, I have a stomach ache, they send you home immediately. If you say you have a sore throat, they send you home immediately until you have a negative COVID, which I understand. I'm not criticizing them for that. But what are the symptoms if my kid has a sore throat? And generally, I would work through that. I mean, if I get a cold, I would work through that. We're in a different time right now, and so I understand that. So talk a little bit about the symptoms the differences between influenza and COVID, and what happens if you get influenza and COVID.
So luck of the draw, I actually like Counselor Selberg's questions better.
Sorry, back of the line.
No, your question is a really, really good one. And it's, unfortunately, I would give you an absolute direct answer if I had one. I don't. And we're actually wrestling with that with our medical staff right now of how do we guide, because testing is not, it's not abundant, and we're trying to prioritize. And so, like you point out, any symptom really in any environment, if it's verbalized, it's going to be taken very seriously because of the pandemic. It makes sense. The quick answer I would say is it's really difficult to differentiate between the two. In fact, if you lined up 10 patients and 2 physicians and said, hey, 5 have influenza, 5 have COVID, figure it out, that'd be tough. What we are seeing with COVID is, just like other upper respiratory illnesses, some of them maybe have more of a GI component, some of them have more of a runny nose component or a sore throat component. In fact, runny nose and new onset headache were just added to the CDC screening. And so you look at that list and it's essentially everything. So I think it's very difficult to clinically differentiate. The only thing I would think is that maybe not as much fever, maybe more cough, although, again, you could line up influenza and say, yeah, it does that too. So, sorry, there's not a great answer there unless the pediatrician has a better answer.
Well, and when you do, if I could just add a little bit on, and you answer this if you'd like, when you do the COVID testing through the drive-through, because if I say my throat hurts, they're not going to have me go into the doctor's office. They're going to have me go get COVID tested first. Yep. And influenza is very contagious as well. And so are they going to do that through the drive-through as well? I mean, does that make sense to just say, hey, we're going to test for influenza and COVID at the same time, just so we know what we're dealing with, because the symptoms are so similar?
Yeah, yes, that does make sense. And yes, that's the plan. It really depends on testing availability. It looks like, and again, we're on a national allocation. So the testing we do is really directed federally, and it looks like they're trying to manufacture a combination test so that if you do have upper respiratory symptoms, you will get tested for influenza A, B, COVID, and respiratory syncytial virus, or RSV. But that's going to be a limited supply. So we will be able to do influenza and COVID tests, and that probably is going to happen at the same time together.
So when you stick I've had the COVID test and I was negative, but I mean, will it be 2 tests or it will be the one together? Is that what you're hoping to be able to do?
Yeah, not sure yet, but right. It's mostly what we were doing in the spring is we were doing 1 swab for both.
Okay, and then my last question, if I can.
Yes.
What's with the rapid test, it's instant results for COVID, correct? Or are we still seeing a lag in turnaround time where people, have to quarantine for 3 or 4 days until they get their test back?
Yeah, good question. Capacity is limited, again, federal direction. So we have the ability from a rapid testing standpoint we tend to prioritize the most symptomatic, especially hospitalized in ER. And so that's a rapid turnaround, less than an hour. We are able to do some testing within 3 hours or less. Really depends on courier time. And then the rest of the testing typically is less than a 24-hour turnaround. But as capacity, or excuse me, as demand grows, that's going to overwhelm our ability. And so some of that testing then has to get sent out. And we don't know necessarily when that's going to happen. It depends on the day. So there's times you may get a test within less than 24 hours, and there's other times you may wait a couple of days. We've made good progress in working with various institutions across the United States to get a more rapid turnaround so that people are not having that, 4 or 5 day type thing.
Thank you. And thank you, Jill, and your team, and both of your hospital systems for everything that you're doing for our community to stay in contact and keep us educated on what we should and shouldn't be doing, and just really everything that's going on. I know it's a very interesting time, so thanks for being here.
Yep, thanks for that.
Before I move on, is there anything that Dr. Elliott you wanted to share on that question?
To reiterate something Jill said, right now we've got about a 15% positivity rate in the county. That's high, actually, from my perspective, but that means 85% of the people that are getting tested are negative. So can we look at someone with relatively mild symptoms or severe symptoms and really adequately differentiate whether they've got COVID, the flu, strep throat, RSV, common cold virus? The answer is no. There's too many overlapping symptoms, and right now there's just too much risk to miss it. So everybody's getting tested, relatively speaking. Everybody's being told to mitigate, to stay home, to isolate until they're symptom-free. The best thing we can do, keep businesses open, to keep schools open, keep kids educated in schools, is to mitigate this as best we can. The lower we can get that number, the more likely we are to continue with some semblance of normalcy, whatever that's going to look like.
Okay, thank you. Next up is Vice Chair Sale.
Dr. Elliott, I want to make sure that I heard you right. Did you say COVID can be transmitted before you show symptoms?
Yes, that's correct.
Thank you.
Okay, thank you. On to Councilor Kiley.
Thank you very much. Can we just talk a little bit about the process of how to get a test, the cost of the test, if there is a cost, is whether you are showing symptoms or maybe you determined you have been in close contact with somebody who's COVID positive?
Yeah, so typically insurance companies are covering the charge for the test, so we submit through to insurance typically, like we do with most tests. And then in terms of the process, again, we would encourage you to try to call, whether it's you call the hotline or you call your primary care clinic. They'll ask what your symptoms are, and then they'll help direct you to, yeah, you should go to a testing center and get tested, or come on into the clinic and we can see you and further evaluate, that sort of thing. Does that answer your process?
Well, I think it does. I mean, insurance, is there usually any type of a deductible that anybody has to pay, or it's just covered by the insurance? So if somebody doesn't have insurance, what would the process be?
Right. So there is a charge. There are some write-offs depending on financial situation, that sort of thing, that get applied as well. So financial limitations should not limit your ability to get the test done, okay? If you need one, we'll figure out a way to get it done, is the answer.
Okay. And then there's questions, I think there's still questions about when to quarantine and when not to quarantine. I mean, we've all known somebody now who's been diagnosed, and there's family members, and there's so much information out there that it's easy to get it confused. And I know that I've recently had a conversation with Director Franken over an experience at one of our training sites where an individual tested positive after attending a little over 50% of their training sessions. There's, in that case, they're going to be contacted by the South Dakota Department of Health. However, we don't know how many days that's going to take. And then in a situation like that, they may or may not know even the names of the other individuals that participated with them. So do you have any recommendations as to what, I know how I handled it at that particular time. Composed a letter to all of the participants that enclosed a link to the CDC, which would help them determine whether they were considered to be a close contact or not in that situation. In addition, recommended that they may consider contacting their healthcare provider and then their HR too if they're working. But I mean, what else can you do to help determine when you need to go a step further and quarantine?
I'd say your letter was perfect. Look at the CDC recommendations. If they're working for someone that has an HR department, certainly check with the HR department. Different businesses may have different guidelines on length of time for quarantine, might even have different guidelines on what they consider exposure to be. The standard answer, and you know what, I'm not even going to give a standard answer because it varies so much depending on if you test positive, you test negative. There's so many variables, which is part of your frustration. So yes, look at the CDC website, call your primary care office or hotline. I'll tell you, we get hundreds of phone calls a day to our hotline with exactly those kind of questions. And then, of course, if you are a known exposure to someone who tested positive, presumptively the state tracers will reach out to you as well and can give you guidance.
If you are determined to have had close contact, is it best to wait 2-3 days before considering have a testing immediately, or testing multiple times during X number of days? Because as I understand it, you could test negative 3 days after exposure, but potentially be positive on day 6 or 7 or at some point later.
Right. There's some differences of opinion in the medical literature on that question. What we're telling people to do is to not wait. If you have known exposure and meet the criteria for getting tested, go in and get tested.
Is there a point where they should consider a second test then before going back to work or being out doing their daily routine?
In some circumstances, yes, but there's a lot of variables there, including your own medical health, the type of environment you work in, the type of people you're going to be around. If you were going to work in an oncology clinic, as an example, where we might have a lot of people who are immunocompromised, there might be a different testing recommendation than if you're going to work at a parks department where you're going to be outside most of the day with relatively unhealthy folks, and social distancing isn't a challenge.
So following that initial test, basically let your symptoms or lack of symptoms dictate what you do from there.
Again, along with trying to find recommendations either from the CDC or HR department or,
Okay.
Yep.
Yep.
I think the difficulty in answering this question just underscores why wearing masks is so important right now. Because there isn't a clear-cut way to be able to, with the asymptomatic spread that occurs, that makes it very difficult to say that someone maybe gets tested on day 5, and is negative and goes back to work because they're a critical infrastructure workforce, but then they're required to wear a mask because they could still become positive. That's why that is so very, very important. And so I just can't emphasize that enough, and appreciate you asking for that clarification as well about asymptomatic spread. Ultimately, though, I will tell you that that is in the purview of the State Department of Health to determine close contacts and determine if you need to quarantine and isolate. And so that's they have been continuing to ramp up staff regularly to meet the demand out there, which is becoming quite arduous, I would imagine, for them to keep up on all the contact tracing and getting that information to people. And so I'll put a plug in for them that they say, answer the call. When you get a call from us, please answer it so that we can advise you properly. So that's an issue for them right now.
Thank you.
I would just add a couple of things in working with a couple of bodies, school boards, et cetera. So the Centers for Disease Control website has good clarity, as does South Dakota Department of Health. Quarantining should occur in the setting of exposure, which is defined by the Centers for Disease Control. And so, or if you have a test pending, so if you do get tested, it's pending, you should be in quarantine. So quarantine is defined as staying away from vulnerable populations. For the most part, staying inside. You can be outside, but outside of 6 feet from someone. So really try to be by yourself. Isolation is in the setting of a positive test, illness. You should really be away from everyone at that point. So an important difference there. We also say, unless you're in critical infrastructure, you can't test out of quarantine, which is really unfortunate, but that's kind of the reality of the situation. As we've seen in studies through the world literature, any time between that exposure and 14 days, you could develop the illness. As Dr. Elliott alluded to, you can shed the virus. Some people tend to shed it more than others. We don't know why, but you can shed the virus before you're even symptomatic. And so it's important in the setting of, if you're in a quarantine and you think, man, I should just get tested and get out of it, that can't happen, because you might get tested in day 4 and still wind up getting it at day 7, and you had the assurance of the negative test, but it was just the disease was developing.
Okay. Thank you. Others, including Councilor Brecky on the phone. We'll go to Councilor Starr, and then we'll see if Councilor Brecky has any.
Thank you. I hope the rotation is right for the tough questions. So now that you've got the microphone again, Dr. Wilde, but one of the things, kind of a follow-up from the earlier questions about the difference between influenza and COVID, shouldn't we in this time try to mitigate influenza just as much as COVID, that it doesn't matter as much? Obviously, I know the difference between that COVID spreads so much faster and the difference. But this season especially, we should be going through some of the same isolation protocols if you have influenza as if you have COVID?
I haven't seen recommendation in that. I mean, we obviously have a lot of experience and probably false comfort, if you will, with influenza, just because we've recognized it and worked with it for so long. I haven't seen recommendation in that regard. I would say in terms of mitigation, that's why both Dr. Elliott, Jill, and myself, and frankly, a lot of people are stressing the need for that influenza vaccination. That's probably one of the best things you can do. But a little bit of a silver lining, a lot of the things that we're doing for COVID, especially the staying home if you're ill, staying away from people, washing your hands, the hand hygiene, keeping them away from your face, is some of the best mitigation strategies you can do for influenza as well.
All right, one of the other thing that we do as a council quite a bit is we look at group activities and permits for alcohol, which usually follows a larger group of people. And one of the things I think one of you said earlier in the presentation talked about the things we talked about back in March and April. Is the CDC still recommending groups of less than 50, or what kind of guidance do we have when we put these large groups of people together?
As I reviewed that, the website and their guidance on community gatherings, they really look at setting risk. as opposed to a number that I can't recall seeing a number off the top of my head, but really looks at low risk, moderate and high risk activities, and just being aware of that risk as you go about determining, permitting, et cetera.
So then as a follow-up, then what would be a high-risk community gathering versus a low-risk or a moderate-risk community gathering? And I know that gets,
Yeah. So
I promise no softballs, so.
Yeah, off the top of my head, just we're trying to recall from the website, a low-risk type gathering would be less number of people, and I can't recall if they have a number in there or not, and at a distant area, and people who have been around each other, so no outside folks within that group. And then the progression goes from there, really based on number of people, where they're traveling in from, things of that nature.
Okay. Does being outside make a difference compared to being inside? I think people feel a lot more secure outside, but as we go, you said earlier, as we go into the winter months, we're going to see some different things. So would indoor versus outdoor versus a large versus a smaller indoor gathering rather than a large room or a banquet hall type of thing make a difference?
Yeah, so outdoor does seem to be, as the evidence is pointing to and recommendations are alluding to, safer. Not to generate a false sense of confidence there, but and just evidence that was released, I think yesterday or made it into the mainstream anyway, was around the ventilations, especially in indoor facilities. And so it does seem that the outside venues do tend to have less chance of transmission.
Perfect. Thank you, Mr. Chair.
Very good.
Thank you, Doctor, for being here.
We'll go to Councilor Erickson and then Councilor Brecky. If you have any questions, please feel free to chime in.
Just one follow-up. I have kids that go to the Sioux Falls School District, and recently, and I know if it's on Facebook, it's always true, right? Just kidding. But somebody put on one of the school district pages that Harrisburg decided to not do close contact quarantine anymore. Recently, it was said that that came with direction from CDC guidelines and or direction with the hospitals. I have no idea if that's true or not, but I'm curious, and I'm not asking, I'm not asking your policy decision on that or whatever, and I'm just curious, it's all over the board at all different places with that if we are in close contact with someone who has COVID and we're told to quarantine, but then they're not doing it in other areas, it just sends a really confusing message again to the city. If I get the call that I was in close contact with somebody in quarantine, should I quarantine or should I not? Because now they're doing it differently again.
Right. To quick answer your last question, yes, you should quarantine. I spent a good chunk of my day yesterday really talking about the first part of your question, was reached out to as a system and myself by members in Sioux Falls and Harrisburg as well. As I understand it, and happy if someone can fact check me, that's fine, but there was an adjustment from a required quarantine to a recommended quarantine. And so if someone had an exposure, it's recommended that they quarantine, it's not required. So we still absolutely recommend that if you're exposed to be in that quarantine for 14 days, which typically is at home or somewhere away from everyone else. If your decision is not to do that, then the request would be that if you do show up to be in a mask and practice all hygiene measures that I've alluded to already, and if you do not choose to do that, then you'd be asked to stay at home. That's how I understand the decision with that school district.
Thank you.
Yep.
Councilor Brecky, any questions from the phone?
Yes, just one. In past briefings, we've talked about the demographics and who's at the highest risk and how we're comparing with what the perceived dangers are, from an age population standpoint. Are those things proving out true in our own locality? That the higher risk for death and for, obtaining it is in those people who are already compromised and are aging? Or is that, what are our actual numbers in our MSA showing us about the demographics and who's getting it and who's dying and who's recovering.
And Dr. Elliott, can I just make sure you're close to the microphone with the mask? I'm being told it's hard picking up on TV.
Sure, absolutely.
Thanks.
So yes, chronic comorbid conditions like diabetes, like congestive heart failure, COPD, are known to increase your risk for requiring hospitalization and succumbing to COVID. Age is another factor that we recognize as increasing one's risks. As an example, I believe this is national data. If you're 60 to 69 years of age and test positive for COVID, your chance of being hospitalized is in the 10 to 15% range. If you're in your 70s and test positive, your chance of being hospitalized jumps up to about 25%. If you're 80 or above and test positive, your chance of being hospitalized is closer to 33%, so almost a third of those people end up in the hospital. So yes, there are still risk factors involved with hospitalizations and death rates.
Thank you. Councilor Kiley.
Just quickly, so it's clear that it's up to us as the public, as individuals, to implement mitigation procedures, the proper hygiene, use of masks, social distancing. Then it's also important for individuals to recognize what their symptoms are, what the symptoms are of COVID. Is it true that elevated temperature is generally the first symptom?
No, it's not necessarily the first symptom, and elevated temperature is actually only present in roughly 70-75% of COVID positive people. So you can be completely fever-free and still have COVID. You can't hang it. Unfortunately, none of the symptoms that are listed as risk factors for COVID, none of them are 100%.
So what would you recommend then, besides monitoring your temps, loss of smell, loss of taste? What are the important things to monitor?
Yep, all of those things. Cough, runny nose, shortness of breath, sore throat, headache has been added to the list. As you said, loss of taste and smell, fever. If you have any of those symptoms, then you have to begin to think, I could possibly have COVID and I've got to follow appropriate precautions.
Which are also symptoms for, many of them are symptoms for common cold. Make the assumption that you are positive for COVID.
Right, 85% right now of the people getting tested in our area are negative, but they still have enough symptoms that they qualify for testing.
Thank you.
Okay, other questions? If not, I do have a few. Can somebody just clarify where we are in vaccine development? I mean, it sounds like we might be getting closer.
Correct, we're getting closer. There are several companies actually here in the U.S. and around the world that are working on COVID vaccines. Two appear to be front runners, I might say. They're in phase 3 trials. Last I read, they've recruited about half of the number of people. They're roughly looking for about 30,000 people to be involved in their phase 3 trials, and both Pfizer and Moderna have had about half of the people that they need enroll in the phase 3 trial.
So months potentially versus, I mean,
it's a great question. I'm not sure I have a good answer for you. I've read anything from before the election to not until the first of the year. I don't know, Mike.
Looks like, yeah, Dr. Wilde has.
It seems pretty widely dispersed is when we might see the first vaccine available.
Okay.
So we've along with the other healthcare providers in the state, have been on weekly calls with the state health department, who is on at least twice to 3 times weekly calls with Centers for Disease Control. No certain date, but it looks like the first phase of vaccination will start perhaps in early November, and then become more ubiquitous or across anyone seeking that vaccination after the New Year's or around that time, with hopefully continued supply through that time and multiple avenues of getting that. So that's as of last Friday, with anything with this pandemic subject to change.
Vaccines are incredibly important. That being said, are you aware that they're going through the normal testing process? There's no shortcuts or anything? Because obviously a concern would be that there would be an untested vaccine and any side effects.
Yeah, like Dr. Elliott alluded to, this is all part of the federal program, Operation Warp Speed. And so a normal vaccination, as I understand it, can take up to 10 years to come out. And obviously that's not the case here. So I don't know if I'd label anything as a shortcut, but there certainly is some speed built into the development. So there can be phase 1, 2, and 3 trials. Phase 1, you'll look at models within a lab and looking at safety and activity in that setting. There can be phase 2, which might be, again, model type tested or animal tested, looking at safety, and then phase 3 trials looking at safety and then efficacy as well. And there's going to be a shorter duration of those trials, just based on the federal guidance.
Okay. And then as far as healthcare providers, obviously every patient is different, but I'm curious, have practitioners learned of new treatments, things that have worked better than others? Because obviously you continue to learn, whether it be maybe there's some sort of medication that's off-label or there's some sort of mechanical equipment. What have you learned anything?
Yeah, absolutely. Rapid learning through this time since March. Certainly some evolution in our treatment, and the symptoms, the pathology that COVID causes is really similar to some other things we've seen, although not in a pandemic form in medicine. And we kind of relearned or learned that the best way to treat this is to do what we know how to do. And so we've been using anti-inflammatory medications, obviously remdesivir, and then most recently convalescent plasma at Sanford. We have research ongoing in several of those areas in addition to vaccination. Within Sanford, across all of our markets, we have weekly calls looking for the latest updates that are out there from the various societies. So we'll have infectious disease and critical care and primary care all discussing best treatments and then experience that we've had and what worked and what didn't. So tremendous amount of learning.
Great. Okay. Looks like we have one more from Councilor Colley.
Well, I thought of something that I'd originally had a question on and didn't ask. Both of you had mentioned that hospitalizations have increased, and Dr. Elliott, I know that you said that I think locally it was about 30. Dr. Wilde, I'm not sure if you stated a number, but you have seen an increase. Can you tell me what percentage of your capacity, and should I refer to it as COVID capacity? Because obviously you need to have capacity for other reasons, heart attacks, cancer, things that other people need treatment for. So can you give me a percentage of where you think you're at currently, and what's the manageable range yet?
Sure. I can't give you a percentage because I can't do that math that fast off the top of my head. I need a calculator, but we have capacity. We have been at these volumes historically in the past through the year. Like I alluded to when I gave that presentation earlier, we plan for surge, we plan for high times like this. We have the staff available, we have the beds available. And so, and then we look at other levels of response as well. You know, how do we work with our facilities in Vermilion or Aberdeen or Laverne or where they, and so certainly looking at that as well. And like Dr. Elliott alluded to, they're going to get quality care no matter where they're at. So we're comfortable with our capacity, but people are working hard and they're very dedicated.
And I think for us as public officials, it's important for us to know just what that manageable capacity is, because we were basing decision months ago.
Yep.
And one of our goals, stated goals, was that we did not want to overwhelm our health facilities. And that still is our goal as well, too. So we need to know that kind of information in order to make the decisions that we have made in the past. And I don't think any of us are interested in going back to any of those unless it's absolutely necessary.
And that's been the significance of the EOC that both Dr. Elliott and I participate in. So we have real-time communication with where we're at, and we check in on a routine basis, but knowing we can communicate in real time if there's opportunity where we're getting close to where we could use some help, and we're nowhere near that at this time.
Good to know. Thank you very much.
Thank you.
Okay, just a few takeaways that I put down. Make sure to get your preventative care. Don't ignore symptoms, whatever they may be. Something that's easy to treat now, you delay it, it could become very serious. Make sure you get to the doctor and you communicate. Make sure you take care of yourself, all of those normal preventative things as it relates to the flu. And one of the other big things is mental health is a major issue. So everybody needs to remember you're not alone. Ask for help, and it's out there. And don't be ashamed. Contact your healthcare provider or somebody else that you care about, and get the help you need. It's far more prevalent than what people think, and it's been a really stressful time. And fear and anxiety can be crushing to the soul. So you need to make sure you ask for help if you need it. Thanks for all of your time. It was great to have you both here. We always appreciate having you both here. Valuable time. Thank you. On to our next item. August 2020 monthly financials by Sean Pritchett, Director of Finance.
Good afternoon, Council. So bringing forward the August financials, we didn't have a presentation for the July financials due to the budget, so this is our opportunity to kind of catch up on the last couple of months. We'll start off again with some of the economic indicators that we run through on a regular basis. So you can see here that our unemployment numbers, or actually our employment numbers, you see some recovery in terms of the employment since it downturned earlier this year as a result of the pandemic. You do continue to see relatively steady growth within our overall labor force. As far as unemployment, you can see we kind of maxed out at 10.5%. That was back in April. As of July, we were down to 5.5%, and that compares to about 6% for the state overall. And the national average, excuse me, I don't have the national average in front of me, but it is still hovering about 3 or 4 points above the statewide average. We've also continued to monitor the insured unemployment rate, a slightly smaller segment of the employment or labor force here in South Dakota, but it's a more timely indicator of where we're going or where things are trending. And you can see relative to most of our peers across the nation, South Dakota has remained either having the lowest or second lowest insured unemployment rate. You can see here that's about 1.5%. And about 6,500 continuing ongoing unemployment claims as of last week. We peaked out about 25,000 here earlier on in the pandemic, so that's been a significant improvement here over the last several months. Inflation has upticked just slightly. You can see it's up to 1.3% in August of 2020. Again, you see the greatest inflationary pressure you have right now is on the food sectors within groceries and things of that nature. And as far as energy prices, they still remain in negative territory, so they are keeping pressure on lower inflation rates overall. But you are starting to see some upticks in that regard. As far as our building valuations, nothing is really changing in terms of trending that we've seen before. Today, through August, we've had $410 million in building permit valuations. Year to date, that's tracking about $78 million behind last year and about $166 million behind the year before. New commercial values continue to trail through August of 2020. They're down about 40% versus August of 2018, and 25% relative to last year. And this is largely due to the office, institutional, and other commercial sectors. New residential values are up 9% relative to last year, so that has been the strongest portion of the local construction industry. And you can see a fairly significant turnaround, especially in the multifamily side. Overall, housing permits are up about 21% through this part of the year. And again, that's driven by the multifamily as well as partially by the duplex units. We have also seen some increase in the single-family housing, but that's been very moderate. So we're up about 51 units in terms of townhomes over last year, but in the multifamily units, we're up about 161 units compared to the same time period last year. Again, that can vary considerably just depending when you have a large number of projects or more significant projects as to when they bring in their plans and when they are approved. Overall tax collections, you can see that our growth rate was down 1.9% for August. This is relative to 11% growth in August of 2019. So that was going to be a number that was going to be very difficult to increase over. And as I noted to you previously, that's going to be very challenging to increase over through the remainder of the year. We had 8% growth, 6% growth, 9% growth months toward the end of the last year. So being able to have growth over and above those will be challenging as we get through the remainder of the year. But on a positive standpoint, we still remain in fairly good territory and seeing from where we were 3-4 months ago. But our 12-month rolling average did decrease slightly to 2.3% overall. So we have been projecting that we'd end the year probably around 0% growth rate, and we're still kind of trending in that direction. We're about, if you were to look at our year-to-date numbers, we're down about 0.4%. Just in general. If you add back our sales tax audits, which are not included here, so when they're going out and auditing firms for sales taxes, once you add those back, and those can be really variable, we are actually up just very slightly at 0.2%. So again, we continue to trend that. I think it would be positive if we continue to see ourselves kind of breaking even with last year toward the remainder of this year. You can also see in the entertainment tax, seeing slightly more positive news here. This was an area that took a significant drop, particularly in the month of May, where you could see it was down 47% over the prior year. In August, we were only down 3.8%, so that's a fairly significant recovery that we've seen. What's driving that is restaurants, lodging, food stores. Those comprise the three biggest sectors of the entertainment tax where it's assessed. So restaurants, they comprise about 50% of this tax base, and they were up 3% overall over the prior year on the same month. So the first time we'd seen growth in that area for some time. Lodging continued to be down. They were down 27% in August, but they were down 84% earlier in the year. So I would expect lodging will probably hover in that 25% to 30% down going forward, probably for the remainder of the year. Hopefully we stay in that territory. Based on the more recent occupancy numbers, that seems to be where things are heading at this point. And as far as our industry data, this shows the actual 10 biggest sections of our sales tax base. So this shows you what areas contribute the most to our sales taxes, and the largest being department and general merchandise stores. So this would be your big box retailers and the like. And you can see other ones like home furnishings, wholesale trade, grocery stores, lumber. These are also major contributors to our sales tax base. Most all of these saw growth in the month of August, so that was positive. You can see in some prior months that was not always the case. You see that eating establishments or restaurants are still in negative territory when you look at the sales tax base overall, but have had significant improvement over the last several months. Manufacturing has taken a downturn, so that's something we continue to monitor closely. Agriculture is another one. Some of those that are more broad-based in terms of the national economy, wholesale trade as well. So we'll continue to monitor those. One that took a significant decline last month was in the insurance industry, and not exactly sure what that's tracking, but that was down over $10 million in a reduction of their sales tax base. One area that was up significantly was healthcare services. That was up 153% in August versus August of 2019. And I think that what was driving that is maybe some of the pent-up demand for surgical and other medical things that hadn't occurred in the prior months related to COVID. So again, I want to remind you, the August data relates to July transactional sales. So we're always a month in arrears in terms of what you're seeing for activities there. Property taxes, you can see we were at 37 million through August of 2020. So we're seeing an increase over the prior years. So we continue to see growth and don't have any major concerns in terms of the property tax receipts. Year-to-date lodging, we've talked about this a lot in the past. You can see we're trailing in 2019. We're down about 25% for the lodging taxes. And as far as the bid, we're down 23% on a year-to-date basis. And again, these are transferred over to the CBB or Experience Sioux Falls to help fund their operations. General fund, you can see here that to date we have collected approximately $127 million of revenue. That's about 73% of our budget. If you compare that to last year, we had collected 63% of our budget up to this time. There's a big outlier here, and that is the CARES Act funding that was received in the month of August in the amount of $21.6 million. So that is inflating that number significantly for the month of August. If you were to remove the CARES Act dollars, we would be about 60% of our budget collected, which is probably a better indicator of where we're at just in general from an operational perspective when you remove that item. On the expenditure side, we have $105 million in expenditures through August of this year. That's about 59% of our budget. If you compare that to last year, it's about we had expended 62% of our budget, so we're about 3% less than last year. And a major portion of that, as we discussed in the past, consists of holdbacking certain expenses, reduction expenses, particularly in payroll over the summer months, seasonal salaries. You can see parks is significantly lower than where they are typically at for this time of year. The other one that is noticeably lower is highways and streets, and that's driven by the snow budget, which is $1.6 million lower than what it was last year at this time. And we'll continue to monitor that throughout the remainder of this year, but hopefully not as many snow events will result in some lower amounts there as well. I would point you to page 1 of your financial report. It's not the first page, but it's the one labeled page 1. And I'm going to point out a couple of items there, just as you can see at the top of that page. This is the general fund summary. It shows an available balance projected available balance at year end of $54.7 million. I just want to highlight the fact that we are not projecting the CARES Act money as part of that, intentionally to help you see just generally how we're doing relative to our normal operational income and expenses. So we still at this time are projecting that absent any CARES Act money, we would be utilizing approximately $1 million of reserves this year. I believe we budgeted over $3 million for this year. So, so we're based on reduced expenses and some better revenues and sales taxes than we had originally anticipated in the earlier portions of the pandemic. You will see in the actual line item there showing the available fund balance of $77.6 million. That does include the CARES Act money that came in the month of August. You can also see that showing up under federal and state grants where it's showing $26 million versus a budget of $5.8 million. So that's where a lot of that is coming in. The other thing that's probably a notable discrepancy on budget versus actual is our income for charges for goods and services, which is currently at $3 million and only 34% of budget compared to where we've been at 53% and 56% in prior years. So that's a fairly substantial difference. What that is accounted by is basically 3 factors. One, about $500,000 is related to wildfires when we're supporting wildfires, and we have some charges that or income that results from that. So you will see some of that coming probably in September, is a little bit later in the year. The second piece and the largest portion is charges for health clinic charges. So the health clinic had been closed or under very limited services there for a while. So that reduction is about $4 million related to that. And then about $1 million is related to charges for things like pool passes for the outdoor pools, which remain closed for this summer. So that relates to that discrepancy there as well. In October 6th, of course, we'll be coming back with a second reading of an ordinance to discuss utilizing the $25.2 million to pay down debt. A lot of that coming from our unfunded or unobligated balance related to the CARES Act funds that we received. And then we expect additional CARES Act funding rolling through the rest of the year. So in terms of projects and so forth, one of the things that I was going to be mentioning is that we will be reaching out to you directly as counselors here over the course of the next month or so to begin to get feedback on some of your ideas and suggestions as it relates to those funds. We won't be seeing many of those funds now until, as the year progresses, we'll be taking in certain amounts in the months of October and November. And we don't have a lot of shovel-ready necessary projects because the snowflakes will be coming soon, and in that result, we won't be able to really initiate a lot of new projects this time of year, so it will give us an opportunity to have some discussions with you about utilization of those funds, whether it's to shore up fund balances, additional projects, and so forth, and maybe looking at a work session with the council either in later November or something in that time frame. So we'll have some time to be able to interact with you. But I wanted to put that out there so you can begin thinking about some of the things that might be changes in investments for the city as we go into the months ahead, whether it's in 2020 or 2021 as well. So the other thing I want to highlight as part of this financial report is some supplemental appropriations that are going to be coming to you on October 6th and October 13th for second reading. These are primarily related to grant-related expenses in 2020 that were originally not anticipated. Some are related to COVID impacts, and then they all, varying ones, some are related to capital programs, some are related to OSEP, and some are related to operating requests. So I wanted to highlight those for you today so you were aware of those before they came to you on October 6th for action. The various directors will be here would be able to speak to these in more depth, as well as we'll be able to answer any questions you have between now and October 6th as it may relate to any of these, but I did want to highlight them for you. The first is police OSEP. There's a number of these. It relates to two grants, one for $71,000, which was COVID, it was a COVID emergency supplemental funding, or a CESF funding that we received, and $42,000 is related to JAG grants. And specifically, these are related to items such as trailer-mounted message boards, steel barricade systems, a drone tether system, portable lighting system, tactical robot, and night vision devices. So those are the anticipated use of that funding. We also have a request from Health for $79,500. These are also COVID-related grants that they received, and they would be used for two purposes. The first being a mobile medical van, which would be used for COVID testing, medical outreach programs, and vaccination events. The second is a transport van, which would be used for the delivery of COVID care packages to vulnerable populations for outreach and care coordination with appointment transportation for the Ryan White population, and that would be related to HIV population. The third is a OSEP item. This is not a granted item. This is a transfer from the concrete pavement restoration, so it's a change to the capital program for the automatic brine system. We talked a little bit about this as part of the budget, but allowing us to be able to purchase this equipment this year in order to initiate the use of brine system for salt on the roads going into the next year, or the next winter season. And then the last one is water reclamation, and this is funded by user fees for $560,000. This relates to the purchase of a water reclamation Vector truck that would be utilized by the water reclamation system. Lead times for these vacuum jet trucks is currently about 15 to 18 months. And the cost of the machine is built into the current rate model. It gives the city a head start on being able to get this order placed, but it wasn't originally in the OSEP at the time that it was approved. Another is a $1.2 million FEMA grant that the city of Sioux Falls applied for, working with CCOG, and received, and it allowed us to be able to accelerate the purchase of homes in the Rose Lotta area. So we've been designated $500,000 for each year for this purpose. We received an additional grant for $1.2 million, which will allow us to buy 7 homes to be purchased. You can see those are highlighted in light green in the map that you see in front of you. The items in dark green, those are ones that had already been required by existing funding. In that kind of salmon or pinkish color there, you will also see those are the homes that have been appraised and are contemplated for 2021. And then in the orange, those are homeowners that have shown interest, but we currently don't have the designated funding in 2020 or 2021 in order to acquire. The next supplement is from Highways and Streets. It's for $4.035 million. This is all state reimbursements, so the funding source is the state, but it's being utilized for 2 projects. The first one being Marion Road construction from I-90 on north. Project design is currently underway. An accelerated schedule is needed for the improvements to be completed for the upcoming development in Foundation Park. The project is yet to be bid, hopefully this fall, and allow traffic signal equipment procurement. There are long delivery times for these, and so they're looking to move those forward. The second piece is 41st Street improvements for right-of-way acquisitions, and that's for $3 million. And this relates to the 41st Street improvements that would be going to construction in 2022 and 2023 with that diamond interchange that had been discussed previously as well. So these are just accelerating some state funds in order to keep moving these projects forward. There's a couple of operational supplements. The first one is being TIF. This is a net one. It doesn't affect our budget much. But as far as the TIF, the valuations on 3 areas, Sanford Sports Complex, Whittier Heights, and the Cascades, are higher than originally budgeted to be coming through. And so this is to supplement it to transfer money that will be coming to us through the TIF property tax receipts that are then under our obligation with the development of those areas are transferred to the developers. Housing has a $1 million supplement request. $400,000 of this is the ESG grant that received by Housing that's covering the recovery center that was set up earlier this year. And then they also received $600,000 in additional CDBG block grant funds that they will be requesting to be obligated and using to help set up the housing clinic. They also, not noted here and not included in this supplement, is they received another grant for $800,000 from, or a direct obligation of $800,000 from CDBG, which would likely be used for some sort of affordable housing project, but I don't believe those are fully confirmed yet, and we'll be bringing those back at it. Is potentially part of 2021 budget, depending on when they hit us. The last is entertainment venues, entertainment tax fund, and this is for a $2.5 million request for a change in the budget. This relates to the entertainment center or the entertainment complex, the Premier Center, the Convention Center, as well as the Sioux Falls Arena. So $2.5 million is what we're projecting is going to be the loss on that facility for this year. This is a little bit new for us because we haven't taken a loss on that facility. And it's funded by their own funds, their own balances that they have in our accounts that are run by ASM Global. But we don't run their revenue and expenses through our books as a city, but we do note their equity balance as part of our books. And then we have to adjust it from year to year depending on whether it goes up or down. So every year that we've had it so far, they've generated income. Their equity balance has gone up. We just add it as income in our budget. Doesn't really require an appropriation. Given COVID, the pandemic, and the loss of events occurring there, and the cancellations that have occurred over the last 5-6 months, we are currently projecting through the end of the year about $2.5 million that would have to be essentially appropriated, although it is funded from their own internal balances. They've had about $5.2 million of earnings over the last 5 or 6 years, and that's where the $2.5 million essentially is funded from for that piece. With that, I know that was a lot of information, and I'm sure you're going to have some questions on that in the weeks ahead, but we're happy to answer those as we move toward October 6th.
Thank you. Councilor Selberg.
Thank you, Mr. Chair. Thank you for the presentation, Director. So, general fund, we've collected 73% of the budget so far this year, over 63 at the same time last year, but we'd be at like 60, you said, if we didn't have the CARES fund?
Correct, and that's driven primarily by reduced sales taxes for this year, below our expectations for this year, as well as you'll see probably the other biggest generator is the reduction in charges for goods and services.
Okay. Do we have, for that CARES fund, do we have other funds scheduled to be received from that in the near future? Was that a one-time?
Correct. So we're continuing to collect it over the course of this year. So it's about $41.5 million is the total amount. We've collected 21.6. That was through August. I think we're expecting another 4 to 4.5 million this month. If the council approves, that would be utilized in October to pay down the 3 loans that we're bringing forward to be paid down or refinanced. And then we would also have probably another 16.5 million that would be coming in for the remainder of the year. I would expect it should be fully collected by about mid-November.
So about 4 or 5 million a month will come in through the end of the year?
Correct, yep.
All right, thank you.
Others? Councilor Starr.
Yes, thank you, Mr. Chair. So with the $2.5 million loss with the entertainment venues or the complex, the entertainment complex, are we looking to do a supplement for any of the other city-owned entertainment venues at this point?
No, so most of our other venues are not, what I would say, owned accounts by the city. So our structure with ASM is slightly different than the others. So when we contract, say, with Washington Pavilion, the operations, the gains or the losses are really, as an independent nonprofit entity, their gains or losses. So we provide them an operating supplement each year, but we don't necessarily are impacted by their gains or losses, not any more than, say, the CVB or some of our other ones, Great Bear, for example, or the zoo. Where ASM Global is a little bit different is the fact that they're technically our accounts. So we contract them to manage our facility, but they operate with our funds held in a separate checking account. The income and expenses don't run through the city, but the equity position does. So it's essentially part of our entertainment tax.
Gotcha. Would it be something that we're looking at that we would, whether it's the zoo or the Washington Pavilion, Great Bear, I'm trying to think of off the top of my head, where it would be appropriate to use some of the CARES Act money to help them shore up some of their losses and get them where they're at? Or what are they communicating with you where they're at? I'm sure there's a need, but what are we telling them, I guess, at this point?
With most of our partners, we consistently like to communicate and make sure that they're doing financially okay. My understanding, talking with the zoo, is that, you know, obviously they've been challenged in some respects for the portion of the year, but they've had some positive things occur as well. The Washington Pavilion, with great fortitude and fortunate, was able to build up a fairly good reserve over the last 3 years, which is not where they were 10 or 15 years ago. And they were in a very more of a precarious financial position. Thankfully, they were in a very strong financial position coming into this. So they've certainly taken their challenges, but they haven't necessarily, they've been able to accommodate that. Another piece of that is these nonprofit entities, they qualified for PPP loans. Pavilion did, Great Bear did, or I'm assuming Great Bear, I believe, did. The zoo did. So they received PPP loan dollars, which can convert and mostly will convert into grant dollars. ASM Global, that's not possible because they're just an extension of the city.
Makes sense. One more then, just kind of as a follow-up. With the zoo and the pavilion partnership that the city had with them, how well was that program used? Just to, you know, was it something that members of the community took advantage of?
I'll have to go back and get you exact numbers on those, and I think that concluded as of September or Labor Day, so I can get you additional figures. I think it was more utilized for the zoo than the pavilion, but the pavilion would say that it still was a major, both an assistance to them, but great for bringing people into the community that may not have had an opportunity to take advantage of the pavilion. So we'll be able to get some figures that now.
Perfect. I kind of caught you off guard on that one too, and so that's unfortunate that I came from left field with that.
I think we obligated 200,000 for it, and I'm not sure if we maybe hit 100. I think overall is that
more what I was looking.
But
thank you.
Other questions? Not seeing any. Digging into the entertainment tax issue a little bit. So to be really clear, when we look at the current cash balance of the entertainment tax, that includes the operating account that ASM Global is working out of? Is that correct?
I believe the way it shows up here, and I have to look at the financials, it may show as, so we show a $5.6 million balance, and it's not showing any restricted. So I'll have to go back and check. I think we show a certain amount designated. I'll have to clarify that, where you can see off to the right where it's designated versus on the cash position. But we do maintain, with the entertainment tax fund, certainly we maintain our own balance within that account and have done so just in large part for potentially circumstances like this. that are going to occur. But to be frank, this does hurt us in the long term. Just the reductions of the entertainment tax period has created issues. The loss of revenues at the event center creates issues. Are they going to be substantial or devastating for us? Not likely, especially if we hopefully see some major recoveries here in the later part of the spring of next year. But what it is going to do is it's going to defer maybe some major rehab projects that we had contemplated earlier on, such as replacement of the ribbon boards or replacement of the digital screens and so forth that we might have programmed, 5 years out or 6 years out, that it may have to be pushed out a year or two just to recognize the reduction in revenues from this year.
So in plain English, I don't know that we have do we have their cash balance listed here somewhere?
Typically, what we show is their equity balance. So I can get you the information that kind of distinguishes between our cash balance and their equity balance as the total amount of the fund.
I assume they have a burn rate, so their cash balance presumably because of this pandemic has been going down, and so they're asking to access another $2.5 million?
Well, they have an equity position of over $5 million at the end of last year.
Mm-hmm.
So that equity, it's kind of cash essentially for them on their balance sheet for the event center complex.
Mm-hmm.
But they also have a lot of deposits and a lot of unearned revenue. So there's a lot of things that flow through their cash account. Essentially, the net equity position is the best way to gauge how much of the cash is actually free cash to them. So that's the $2.5 million is part of the 5.2 they're already holding in cash in their accounts.
Okay, well, I guess what I'm trying to get at is when we do this appropriation, I mean, in the real world, what are we doing? We're allowing them to
You're
access.
allowing an expense to hit our books that we hadn't contemplated at the time. So it's an expense to us, but we're not transferring any money.
So the money has already been lost, we're just recognizing it?
We're just essentially recognizing it.
And so is that going to change?
In order to recognize it, it has to hit an expense, which will be on our books at the end of the year.
So we're going to see the current cash balance drop by?
I'll have to look, I'll have to
amount?
check to make sure this doesn't reflect their cash balance versus our cash balance. So I can get clarification on that.
And what about going forward? Obviously, this is we're not isolated, so no matter what we do, there's some things that we can do, and I know there's initiatives with Experience Sioux Falls, and some things are going to be done to try to have more events. But to some extent, we're somewhat handcuffed by globally and nationally. So, I mean, I think we need to see as we're doing this, what is their burn rate? How much are they spending out there right now? I mean, do we have tons of employees working and there's nothing going on? And are we going to be back doing this again in 6 months? Are we losing $250,000 a month? Going forward, what can we do to either cut expenses or do whatever we need to do?
They've laid off employees, they've furloughed employees, they've taken employees to every other week in certain circumstances. They have worked to reduce expenses whereas needed. We're looking at leasing a snow truck instead of hiring contract snow removal this year and having their employees do it as a reduced expense option. But there's just frankly overhead that you have that you can't absolve yourself of. Utilities, heating, cooling. And there is activities occurring, particularly in the convention center. We're seeing smaller gatherings coming back, they're hosting events. So there is, these intermittent ones, but it's just not as full as it used to be with the regular activity that you would see at the convention center because the conventions are just not occurring right now. And then the Premier Center is just the big piece. The concerts just aren't being held right now. And those were a significant part, of their ability to generate income. The other piece of it is the loss of sponsorships and suite holders and things of that nature. When you're closed, you're challenged to accept revenue from them for something that you're not putting on. And so a lot of it is loss of sponsorship revenues and things of that nature as well that you can't stop.
Well, now that you bring that up, so if somebody has a 5-year or a 20-year deal for signage, are they getting a waiver for the year for making a payment?
We've been providing some relief for certain months, but we've been attempting to distinguish as to when that will end. When will events return? And that's the challenging part. We would have expected that those would have started to occur at this point, and yet we're continuing to plod along. And as you said, we are captive to what's happening nationally. And especially with touring shows. They're just not going to tour right now, irrelevant. And some of it is health related and some of it's just perception. They don't want to be perceived as people touring right now because of the public backlash that they'll receive from even hosting a concert. So that's unfortunate, but that's the world we live in right now.
So maybe last question. So everything besides capital expenses, the large capital expenses like replacing a ribbon board, everything, the heating, the cooling, all the stuff it takes just to essentially keep the building conditioned, that is all coming out of it's being expensed to them?
Correct.
Okay, and so I'd be curious, like what the overhead is.
What comes out of our accounts is primarily repair and maintenance and capital improvements. And so those are the things that we're funding out of the city's cash accounts. And those are a lot of the things that we've held back on just as a result of the entertainment tax not coming in what we originally had contemplated. So we held back over $2 million in projects, both from the pavilion, the Orpheum, and all of that. We continued with timely ones, the ones that were appropriated to do. It was black for a while there, in terms of having a free facility, so it was timely to be able to go in there and make some improvements that you couldn't do when you were struggling to find the time to do it. So we did move forward with some projects, but many others have been, I guess, put on the shelf for now, pending additional insight as to when things recover.
Okay, this is really my last question now that I'm thinking. So is there, obviously it's the operating account they're working out of, but it's our cash.
We own the accounts. Their cash is not reported as cash in our balances. They report their net equity position as part of the entertainment tax.
But I mean, it's money that's in trust. I mean, at the end of the day,
they are entrusted as the management entity.
They're managing our money.
Yes.
So we have a very direct interest in how they're spending our money. Have there been discussions, and I don't need to know specific details, about where the city is able to look at their books and say, hey, how can we reduce overhead here? Because this is maybe not going away. How many employees do you have out there? Do you really need as many? And I don't know the answer to those questions, but it's just a concern, so.
We continue to have those conversations. We've also wanted to maintain the infrastructure as well. Earlier on, we didn't want to affect the employment issues we were seeing just in our community by saying, there are some communities that just shuttered them, laid everybody off and shuttered everybody. We wanted to be a little bit more proactive than that and be able to say, okay, what can we be doing to, they did a lot of cleaning, fixing up of the facility, painting of that. What are they re-obligating people to do internally to keep things going and be ready when things turned around? That has taken a little bit longer maybe than we originally anticipated, but it will come. And we are seeing more events. Frankly, we're seeing more events than most entertainment facilities in the nation right now. Based on that commitment to doing that. But yes, we continue to have ongoing discussions in terms of repairs and maintenance and things like the snow plowing things where we can drop those expenses to get through this. On the fortunate side, they built up a balance over a period of years being profitable, and that's helpful to get us through periods like this without the city having to obligate tax dollars to support it.
Very good. And again, to be clear, it's not just about cutting, it's also how do you generate revenue, and that's why we're doing things to try to create more events. And then as you implied, there's also a side benefit to some extent. There's some things that you can do without patrons necessarily. There is much to do repairs without disrupting. So there's some things we can do. So there's two sides of the coin, the expenses and generating more revenue. So, okay, we'll keep an eye on it. Thank you.
Thank you.
On to our next and last item, I believe, which is item C, pedestrian safety at intersection. This is going to be presented by Councilor Erickson, and I do want to thank PD and the Assistant City Attorney for staying so long. Many times you have no idea how long you're going to be here, and I'm sorry we're almost 2 hours in. So appreciate you spending all this time.
Thank you. I'll just open and then invite PD here. They're really the experts in this area. Councilor Neitzert and I have been talking a lot about pedestrian safety at many different intersections. I kind of talked about it briefly during our informational open discussion a while ago, and as we've continued to dive in, there's been an Oklahoma case that has come out on August 31st, 2020 that really restricts what we can do as far as pedestrian safety in the name of the First Amendment and freedom of speech, what we certainly want to respect, but we also need to be mindful of keeping those driving cars safe, as well as those that are standing on the sides of the roads, whether it's for waving a campaign sign or asking for help. There are rules in place, and so as we've talked through this, we've asked PD to kind of talk about what they've done, what they are doing, and what we can continue to do. And this is really just another great example of collaboration that, you know, sometimes we want to do quick fixes and we want to bring ordinances, but we're not always able to. And Chief, as you come up, I also want to just ask, one of the suggestions that Councilor Neitzert and I had talked about was an increased attention by law enforcement into some of these sections, and they did just that. And they had some really good outcomes of it. I've seen a few intersections that maybe aren't as dangerous as they were before, with people really just walking in the middle of cars, and I've witnessed it myself. And so as you go through this, if those are a couple of the areas that you could talk on as well, thank you for being here.
Thank you, Councilor. Chief Matt Burns. This is an ill-structured problem, and we have seen it gotten worse. But because there are significant legal pieces to it, I think it's helpful to frame that up first to have the whole council understand exactly the peril we could face in regards to a First Amendment issue. So I've actually asked Assistant City Attorney Keith Allenstein to start off the presentation tonight, explaining that in some detail to the extent that you need it, and then Lieutenant Nick Cook to talk through some of the things that we've taken and the approach we've made to date.
Very good. Welcome, Keith. Thanks for coming.
Keith Allenstein, Assistant City Attorney. Yeah, I'll just be as brief as I can here. What we have in place right now was created a few years ago as a replacement for an ordinance that basically said, for lack of better things, that you can't beg for money, which clearly that is not allowed for us to completely restrict to do that, nor would we want to, even if we could. So basically what's prohibited is soliciting in an aggressive manner, which is defined in ordinance by either intimidating persons, intentionally blocking their way, coming into physical contact, touching them, repeatedly following them if they've given a negative response, and those kind of things. So that's one way. You can't solicit on private property without the permission of the person. That would also fall under trespassing. And you can't solicit by stating that funds are needed for a specific purpose when they're not actually needed for that purpose. The last one is probably the one that we're coming into contact with the most, and that is soliciting from traffic. And basically, it does require a hand-to-hand transaction in traffic because we cannot regulate simply holding a sign alongside the street, because there are billboards everywhere, which is in essence soliciting for funds. So that's what we have in place. As Councilor Erickson pointed out, there was just a decision out of the 10th Circuit just August 31st of this year, which reminds us that we have to be careful about what we regulate and how we regulate that. I think the city of Oklahoma City thought they were on pretty solid ground, because just a year prior, in 2019, the very same circuit upheld another median standing ordinance. I've looked at both of those. I'm not sure that I can wrap my head around the complete difference there about what was justified and what was not, but we do have to remember to be careful if we are going to regulate protected speech, and clearly panhandling is protected speech, or anything that appears to be directed at panhandling. We're going to have to satisfy constitutional scrutiny, whether that be under strict scrutiny or intermediate. We have to have either a legitimate, compelling, significant government interest, in the law that we pass has to be narrowly tailored to try to address that. So that's all I have for now. I'll turn it over to Lieutenant Cook, and I'm available for questions.
Thank you. Welcome, Lieutenant.
Nick Cook, Lieutenant with the Police Department. So what I'm just going to kind of go over is a little bit of history with what we've been dealing with throughout this summer for 2020, because it's kind of been more prevalent for us as far as the intersections are related. we started noticing a great deal of the pedestrian, the panhandling traffic starting in April when it started warming up. We identified 5 main intersections where this was occurring. We've had some smaller intersections pop up where there's problems, but the main ones come down to 10th Street and I-229, 14th Street and Cliff Avenue, 10th Street and Cliff Avenue, which has actually no longer become a problem for some unknown reason, Interstate 229 and Minnesota, and then 41st and I-29. We have some statistical data on calls would be related to disorderly conduct, the loitering, or people in traffic down there. Just for a 5-month period on those 5 intersections, we're about 536 that we can track as a department. That does not include the South Dakota Highway Patrol. They've responded to quite a few of the calls because of the off-ramps, and they handle those for calls for service. So that's just us specifically what we've been dealing with. Throughout the summer, and recently our last one was about a week ago, we've had focused enforcement efforts on what we could enforce and deal with pertaining to the complaints that we received from the public on the panhandling traffic, people walking out in front of cars, being aggressive with our vehicle traffic. As Councilor Erickson said, there has been noticeable differences on the dates that we had that. We've had 6 days last week that we went through and had officers assigned to deal with this, taken away from normal street duties, but they focused on jaywalking, disorderly conduct, littering, public consumption. They were able to make a slight difference because once they could see our vehicles in the area, they tended to leave. However, like any problem area that we have these enforcements, the problem tends to go away for a short period of time and then flows back in or relocates to a different area. We've been looking with our partners with the state DOT on mitigation efforts. They've posted signs now at 10th and 229 and some of the property that the state owns to keep them off there because they were flowing to a grassy area and congregating there. There's other ideas that we're looking at with the DOT and other city officials of what we can do in the future to limit this. The main problem that we're seeing with Mr. Allenstein brought up was the median and them standing in the middle of the road on the median, and the concern for their safety, the concern for vehicle traffic when they either step off or fall off. So they're looking at ideas on what we can do to limit that. Back to what our work has done with these enforcement areas, where we get a little bit of a hurdle with the COVID issues that have come up with our bond schedule, because arrestable offense is now either a bond and release or a citation. So we're seeing several individuals that are getting 4, 5, 6, 7 cites in a couple-day period, or I had a guy the other day that had 4 cites in one day. They just don't seem to mind the fact that they're getting tickets for something we're telling them not to do. So that is what we're seeing as a whole from our department. One thing I didn't touch on, or what I did see last week when we were monitoring it, I watched a gentleman in about a 5-minute period take money out of 5 or 6 cars, immediately leave the intersection going through traffic at 10th and 229, go down to a local convenience store and purchase alcoholic beverage at that time. And the other problem we're seeing is once they keep a continuous pattern of that behavior, they end up getting so intoxicated that they no longer can care for themselves, end up in traffic, laying down on the sidewalks, laying down, falling. So, and ended up with either going to the hospital or the sobering center. So it's difficult on our aspect for that. That's all I have for that.
Very good, thank you. And if you, Chief, did you want to finish up, or do we want to?
I just wanted to say thank you for the opportunity to talk about this today. We do want to increase the public awareness. We want them to understand that there are significant hurdles when we want to enforce what we can and also keep the protections in place, and also for the city in regards to liability. So I want to thank Keith for that piece, and Lieutenant Cook. But this is a problem that we're certainly aware of. We are definitely working on it. We will assign the specific details to deal with it just like we have and track those results. Like many things, we will see this curtail somewhat as the weather gets colder, just like we have at Heritage Park and some of the other areas. But it is helpful for us to consider this as a council and as a city, and how do we want to manage this problem? Because sadly, many of the persons we're encountering in these situations do have serious addiction issues to alcohol and other issues. And so unfortunately, many times, not every time, mind you, but many times, the monies that they are soliciting go to further those addictions. So it goes beyond an enforcement issue. It goes to a societal issue. And you will get more of what you tolerate. And so we're trying to figure out how not to tolerate it within the law. Thank you.
Thank you. If you're finished, Councilor Erickson, we can go to questions or comments? Yep. Okay, so we'll go to Councilor Kiley, and then we'll go to Councilor Selberg.
I don't have any questions, just a general comment. First of all, I thank counselors for your effort in this, and the chief and Keith and our city attorney's office could attest to the fact that I too in the last 6 months have approached this subject on 2 different occasions, and I have been receiving email from concerned constituents, and I just want them to know that we are addressing this. It's not like we're turning a blind eye. We're doing what we can, but we are limited in what we can do.
Thank you. Councilor Selberg.
Thank you, Mr. Chair. So when you say they're getting tickets and don't seem to mind, what does that, so what do they just pay it? And I mean, at some point, if you're not paying your tickets, aren't you in another kind of trouble, or what are we doing there?
Yeah, so most often these tickets will go to a warrant, and just like we see in Heritage Park and other areas, many of these individuals have several warrants, and eventually they will get taken in on them, and then many times some of them are just set aside because of the indigence of the person and the situation they're in. So it is a cycle, and frankly, it's very frustrating for many of our officers that are trying to enforce the law, trying to do the right thing and take care of the issue, but then to see, kind of a lather, rinse, repeat type situation. And that's the reality of it when you're trying to police a situation that has a serious social science aspect to it, like an addiction.
All right. Thank you.
I should say, if I may, that you're going to see a news release come out on this very soon to help educate the public, because we do want to take a kind of a comprehensive approach to this, including the enforcement, but also the education to the public to help them understand that they're a big part of helping us combat this issue. They want to be generous, they want to be benevolent. That's who we are, and we understand that. But that comes with a side effect, and the side effect is more persons doing the panhandling and kind of contributing to the problem.
Others. Councilor Starr.
Well, it's interesting that you say that, Chief, because that was one of the things that probably will get me in trouble. But when you look at this issue, it's the people who are giving the money to the panhandlers that are initiating a lot of this. You're giving a drink to a drunk. And when we're here in Sioux Falls, there are lots of opportunities that if you need something to eat, that we provide food for people. If you need housing, we provide housing for people. We can go down the entire list of social services that we have available. So do we go back to the public and say, look, if you give money out your window in traffic, you're part of the problem too. And that generosity that goes with it is not being very generous to people who need other forms of help that exist. And that if you want to help folks who are panhandling that potentially have issues, their opportunity is to give to the banquet, to give to their church, to give to the Bishop Dudley and do some of those things. Rather, that's how you can help more. By going through a fast food location along 10th Street in my part of town and providing breakfast to people who are on the street is not a way to help people. Actually, it causes more problems. So I'm looking forward to you sending this out and to continue to educate people. Help in a way that makes sense and that can really help.
Well stated.
Thank you.
Councilor Erickson.
I'll just add on just a tiny bit of this. Thanks again for being here. It is such a complicated issue of something that as simple as, all of us keep getting email after email and phone calls, and even when we go places, people are like, what are you going to do about this situation? And it's not as easy as tell them to stop. It's just not that easy. And so with all of the court cases and laws and things, there are some options and there is some direction. A huge component is community education, talking to some of our nonprofit friends and saying, hey, how can we partner with you to make sure that those folks that know that they can get the help that they need. Obviously, they don't supply the booze, and so if that's where they're going to get their fix and people are going to give them the money, that's where you're going to see people go. But in that court case, one of the things was time, manner, and place, and so there are some restrictions, reasonable restrictions, with data in mind that we can do, but it's making sure that that makes the most sense of resources and it makes the most sense for our community, making sure that our officers are keeping our community safe while also keeping those intersections safe as well. I did have an opportunity this morning to talk to Mark Cotter with Public Works, and just he had jokingly said, do I need to be there for this? I said, no, this is something different. And so while we did talk about it briefly, he talked about some innovative ways as well as to kind of make the medians not so friendly. If you go to 10th Street, I witnessed two people standing there. Her head was on his shoulder, and his sign actually said, need a ride to Texas. And so she fell off the curb, like stepped down several times, but it was a matter of time until somebody comes by, and how dangerous that is. But there are some strategies and some things that can be put in, some of those concrete triangles as well as those medians to deter folks from standing in those super unsafe areas, but still allow folks the freedom of speech, whether it's sign waving that you love Jesus or you want to support a certain candidate. So there's ways to go about doing it. It's just making sure it's in the appropriate, safe ways. And we also can't mandate, if certain big box stores want to allow people to stand on their corner, that's their business, that's their property, and they can allow people to camp out there. They can also allow people to sit there and ask for stuff too. So there's so much more to this, and I think that's the key that the public needs to understand, is that we can't just say stop doing it. It's so much more complicated. So thanks for being here. I look forward to working with you guys more and talking about some ways that we can impact us in a positive way.
Any other questions before I fire away? Not seeing any. This is a really challenging issue as we found, and that's what I've tried to educate constituents as they talk to me, that it's easier said than done. We continue to look, and maybe we can come up with something beyond what we have now potentially. So tagging off of what Councilor Erickson said, so in the boulevard, so if you have a boulevard that's directly abutting, let's say, a private big box store, who ultimately gets to decide? Is it them? I'm talking about the boulevard between the sidewalks, so we're in the right-of-way now. Who decides whether they can stand there or not? Do I get to decide as the abutting property owner? Or?
Thank you. If it's in the public right of way, you're going to be hard pressed to prevent somebody from being in there. It's kind of the irony that you have the responsibility for maintaining that, keeping it, but it's similar to the sidewalk. I mean, you have the responsibility to maintain the sidewalk, but if somebody wants to stand on the sidewalk, you can't kick them off. So in that situation, the abutting property owner would not be able to kick them off of the boulevard.
Okay, and related to that, so we have, when it comes to signage, you can put signage on your private property, but we prohibit signage in the right-of-way. You can't put political signs. So what's the distinction of why you couldn't tell somebody that you can't stand and hold a sign that says, need some, whatever it may be, and say nobody can have signage, including a human being holding something in the boulevard?
I think it's just the act of being physically attached to the property that makes the difference there. And they're trying to draw a distinction between objects that are more or less movable.
Okay, so that...
If there's more to the fact that we could prohibit a person from standing there, there's just a difference here about attaching property into the right-of-way. Because you have to draw a line at some point. I mean, I suppose you could potentially allow, temporary signage in the right-of-way. We have chosen to not allow signs in the right-of-way. There's also site issues and things like that as well that probably come into play there as well.
Sure. Yeah, that's where I was trying to figure out where the legal distinction is, why like one would survive a legal challenge of saying no signs in the boulevard, but you couldn't say that people couldn't stand with a sign in the boulevard. So.
I don't know that our signs in the boulevard has been challenged.
Sure. Yeah, that is true.
It may have. I've only been here so long.
Well, as we've learned studying this, it's amazing because this case in particular, as with some others, I don't know that it even had any distinction. That it didn't say that the rule wasn't you couldn't exercise freedom of speech in the median. You just couldn't be in the median. It wasn't even talking about speech, and it was still struck down.
From the Oklahoma case?
Yes.
Yeah, these are strictly ordinances that whether they were, guised panhandling ordinances or not, they are content neutral on their face. So they regulate all sitting, standing on a median in various different ways. And they tried to narrowly tailor those. Some of them were, it can only be so wide or it can only be so far from an intersection. And like I said, within a year's difference, the same circuit upheld one and struck down another.
And that also comes to, so if we say it's a safety issue, if we don't have data to back it up, for example, if we can't show a single example of somebody being hurt, that makes it harder to defend it legally.
It does. The case that was decided in August of this year kind of chastised the city for not having that data and just saying that it's common sense. But if you look at the case from 2019, they all said this, and again, same circuit, same judges, at least it was a 3-judge panel in 2019, basically said that, yeah, it's common sense that you mix people and traffic and it's a dangerous situation. So I'm still trying to wrap my head around the difference in those two decisions.
Sure. Lieutenant Cook made a reference to something of which I've wondered about. When you're talking about off-ramps and you're talking about the interstate system, is there a magical line in which jurisdiction ends for highway patrol versus the city? Like if there's somebody standing on the off-ramp halfway up it, are our hands tied as Sioux Falls police? How does that work?
Well, as long as it's within the city limits, we can generally enforce ordinances. The difference is traffic ordinances. There's a South Dakota Supreme Court case out there talking about using city ordinances versus traffic ordinances as they relate to traffic, because there's a difference in where the fine money goes. And so there are some limitations there, but the main issue is not necessarily jurisdiction as far as the police being able to enforce, but who has the say in whether the person can be there or not. We can't post, we have to rely upon the state to post it as no trespassing or to say to people that they can't be there.
Okay, and finally, and Councilor Starr made reference to this, there's two sides to the coin. There's the enforcement piece, and then there's obviously two sides to every transaction, of course. And so we do focus sometimes on the people that are asking, but the big thing is the people that are giving the money or whatever else. And there's a couple things we could potentially, and I think there was a reference potentially, I don't know if the word was PSA, but some public education, which I think would be really important. And I think a big part of it is that a lot of people have their heart in the right place, but it's a matter of trying to express that, are you giving somebody a hand up or a hand out? There's more constructive ways to do it. And there are other communities that we saw that have signage even, that are at important intersections, that governmental entities have put up that have something to that extent, that, like you're not helping them, or there's other ways that you can give, or whatever it may be, to try to educate people that, give $50 to the banquet, don't hand it out. So, I would hope that maybe we would think about that. There's probably some things we could do with public works and some public education signage. And it doesn't have to be hostile. It can be very positive.
Yeah, and we're going to try to address it from all different kinds of angles. We were just mentioning this earlier. I don't know that we can legislate or enforce our way out of this issue. We have to attack it from different angles and get people help and try to dry up the supply that causes people to put themselves in a dangerous position.
Very good. Anything else for the good of the body? Not seeing any? Thank you for coming. It's a challenging issue, but you're working hard on it. Okay, that covers all of our items. Our last item is public comment. Anyone who has any public comment has up to 5 minutes to speak. Seeing none, this meeting is adjourned. Have a good night.